Hello and welcome to another dental consultation from HelpMeWithMyTeeth.com. I'm your host, Dr. Martin Potter. Today we've had a request from Mrs. 1202 about a fractured first permanent molar. So hang on there and we'll get right into it. Okay, so let's move right into it. We've got a couple images that were sent in, so let's move into our intraoral digital image at first. So just to kind of align ourselves, we have a second permanent bicuspid, first permanent molar, and second permanent molar on the lower right. So these are all lower teeth. Here we have the cheek tissue. Here we have the tongue over here. So just to orientate ourselves, we have a small fracture in here, right between the first and the second molar. So what have we got in terms of restorations? The second bicuspid is virtually unrestored at this point, really no restorations at all. The first permanent molar, we have a large silver amalgam restoration. And the second permanent molar, we have a porcelain fused to metal crown. You can see a little bit of the casting under the porcelain. All this you're seeing here is not natural tooth structure. This is porcelain from the crown. And you're seeing a little erosion or wear that's come through this. That has eroded through the porcelain, and the person now is biting or articulating on the casting, which is just showing that maybe a little age to this crown, maybe a little bit of clenching, grinding, or what we call bruxism. Maybe at night this person's grinding their teeth a little bit, and you're slowly eroding away the porcelain. Okay, so let's talk about in a little bit more detail what we're seeing on this image. Let's get right into talking about our tooth in question, our first permanent molar. So we see, first of all, large silver amalgam incorporates maybe 3/4 of the coronal structure, so large filling. Definitely see some age to this filling. You can see over here, we can see some areas where the marginal seal, where the filling meets your natural tooth, maybe not optimal, a little dark, showing a little signs of age, a little marginal micro leakage. We like to see the margin more like this over here, where the tooth and the filling blend right in without any sort of dark line in between. This is not ideal here. This isn't so ideal. This is less ideal. Moving on into the lingual surface, or the tongue side of the restoration, showing maybe some signs of age here. Talking more about the fractured area, we can see that the tissue around the fracture has this is the restoration where it was butted up against the silver amalgam. You can see natural tooth structure here, and if we look underneath, down near the gum, we can see that it's natural tooth structure down there. So definitely some signs that the fractured structure here was actually natural tooth, and it was part of a cusp fracture. Hard to know for sure. Often with little fractures like this, we actually never recover the piece. They're too small and it just goes down the hatch and we never see it again. Really inconsequential in terms of what it was, if it was restoration or tooth. One way or another, we have to deal with the problem. So before we get into our options in terms of addressing how we're going to deal with this problem, why don't we flip over to our periapical film, which Mrs. 1202 sent in. So here we have similar type of view in this image, although we're looking at a radiograph now. So again, we're not seeing any soft tissue, just hard tissue, just teeth, bones, and restorations. That's all we're seeing. So here's our bicuspid that we saw at the bottom of the picture previously. Here's our first permanent molar. Here's our second permanent molar. This is our fractured tooth. Again, you're not going to see the fracture because it's hidden behind the restoration here. Remember, we're looking at a two-dimensional representation of a three-dimensional object. So all of the anatomy that goes in and through this film, this image, you're not going to see because it's all sort of layered on top of each other. But nonetheless, it gives us a lot of valuable information. First of all, we can see just the size of this restoration. Really jumps out at you just how much of the coronal structure of this tooth has been taken up by the restoration. It's kind of no wonder it fractured. Definitely a weak tooth. Getting into the second permanent molar, we can see the casting here, the crown, The crown, again, surrounds the entire tooth, goes all the way around the tooth. You can see a little bit underneath, there's a pin placed in here. Something we definitely want to look at a periapical x-ray is what is going on around the bone or the root of the teeth. We're looking for any sort of big black halo or shadow that would go around the bottom of the tooth that would indicate some sort of irritation to the nerve tissue, to the interior of the tooth. Not really seeing a whole lot of that here. Generally looks quite good. Maybe you could see a little thickening here of this ligament. Don't think it would really get me too concerned unless we had some symptoms with this tooth. We definitely want an asymptomatic tooth. We wouldn't want a tooth that's having problems with hot and cold or problems with biting on it or aching or anything like that. That's always a little bit more of an ominous sign that there's some damage on the interior of the tooth or the nerve tissue, which we see going up and down. Inside here's the nerve tissue inside here. On the bicuspid, here's your nerve tissue inside here. So we don't want to see anything surrounding any kind of halo, any kind of abnormality in the bone at the bottom of the tooth, but it looks very uniform, looks quite good here. Nothing to get too excited about. The other thing we're looking at is the periodontal health of this tooth, or the gum health of the tooth, the supporting structures of the tooth. We see that the bone, the alveolar crest, or the bone height is somewhere along here, and that's a good sign. If this line here was way down here, sort of half down the root, that, like say we were kind of along here, that would be kind of a bad sign, showing there's been some bony destruction here, some gum problems, periodontal problems that have destroyed some of the gum and reduced the support of the tooth. This is called a furcation, where the two roots split off right in here. We don't want to see any blackness in here, which we really don't see. So generally pretty happy with this film. Generally looking quite healthy. Bone looks good. Ligaments look good. Alveolar crest looks good. Really nothing that's putting on the brakes or throwing up any kind of red light or even an amber light here. So let's get back to our intraoral shot and let's have a little chat about what we could do in terms of restoring this tooth. Right off the bat, what would be the immediate temptation would be just leave everything how it is and just restore the part that's fractured. Just place a filling in here, a bonded composite filling in here. By the way, all of these things I'm referring to in terms of crowns, composites, and restorations, just look down in the listing of the YouTube video. I'll try to leave some links down there in the description to give you a little idea of what we're talking about here, to give you, sort of fill in the blanks a little bit more about these terms we're kicking around, such as a bonded composite filling, which is just a white filling. That's all we're really talking about here. And some would advocate placing a white bonded filling in here, leaving the rest of the restoration there, and sort of be done with it. Very tempting, definitely would be fast, would be the most economical approach. I think on a temporary basis it could work. If we're looking at something to sort of buy us some time to move on to something maybe better, I think that could be a good option. In terms of more long-term solution, probably not. The big concern here is, are we going to get more fractures? This cusp right here of this tooth definitely is a concern that it's going to fracture off too. Hate to place a restoration in here, then this cusp fractures, or this one, or even this one, or the restoration could fracture out. The real story here is placing a restoration here will do nothing in terms of protecting the rest of the tooth from further fracturing. It's kind of a good band-aid, but that's about all it is really. It's just a stopgap measure. So that would be door number one. Door number two would be, how about replacing the entire filling with a single filling? So we remove the old silver amalgam filling, we place a white bonded composite filling all in here, and we would integrate the fracture right into the new filling. So we would just have the tooth and then the one-piece filling placed in here. Definitely a better solution, definitely a step up. Fair bit more work, fair bit more expense, probably double the price. Of course, these prices are all depending on your geography, but where I'm from, this filling would be somewhere around 200. Replacing this whole filling would probably be double that, somewhere around 400. But would definitely be a step up. We'd be able to bond to the existing tooth structure. generally a silver amalgam restoration, especially of this vintage. It's a non-bonded restoration. It's not bonded to the tooth structure, which of course doesn't protect the tooth, makes fractures that much easier. If we were to place a new white bonded restoration, we could establish a chemical bond all the way around here to the natural tooth and would do a lot to resist further fracturing. So that would be door number 2, is a full composite restoration here. Moving on to door number 3 would be something like what we see on the second molar here, which would be a coronal restoration. So we would do a preparation around the entirety of this tooth, place the crown right over top of this tooth, and integrate this into the preparation and really have a much better long-term hope to resist further fracturing. Some dentists would advocate changing the core here. In other words, do the filling first and then move on to the crown. It's a bit controversial. It's definitely going to be a bigger expense. It may run the risk of introducing some nerve problems in the tooth. However, some would advocate that placing a crown over top of an old restoration is a little bit risky. That's probably what I would end up doing. Having looked at the x-ray and this, I would probably be quite comfortable placing a crown over this. Now, there would be a lot of dentists that would argue with me about that, say that that would be maybe a little risky, and there's some truth to that. However, there is risk involved in removing the filling and placing a new core before doing the crown. And the last thing we want is to start symptoms on a happy tooth. If you have a happy tooth and then you crown it, you make an unhappy tooth. That generally makes unhappy people. So that would probably be what I would advocate, save the patient some money, and I think we would get a good result at that. So maybe a little controversial, but that would probably be my approach to the situation. So let's get into our list. So I think our ideal approach here, number 1, would be the crown. I really feel this is your best approach here. It's going to be the strongest, probably the prettiest. We could make the tooth all white, blend it into your natural shade, give you a good bite, and give the tooth a lot of resistance from fracturing. I would go with this approach. If it was my tooth, that's probably what I would do. Number 2 would probably be the full white filling. So remove the old silver filling and place a full white bonded filling. Certainly not a horrible option. Could last for years and years. Really unpredictable as to how long this would last. Of course, that depends a lot on the patient's hygiene, their diet, their habits. Are they a grinder? There's just a lot of factors, as to how long that filling would last. But generally, not a bad approach. Probably not as strong as the crown, but a lot stronger than what's there already. Moving on to the third option would be the small repair, which we discussed previously. This, I think, would be a reasonable short-term temporary measure to buy us some time to move on to one of the other ideas, either a crown or full white filling. Long-term, probably not a great option. Probably asking for a further fracture of the tooth. The last option, which we didn't discuss, is an extraction. Would be actually removing this tooth and placing a prosthetic tooth with either a fixed bridge or an implant restoration. This is a little bit out of the scope of this video, largely because I feel it's a little heavy-handed here. I still think this is a good tooth, and I think we have some good hope to restore this tooth and keep this tooth going. Now, there would be some dentists that would argue with me about that, but to actually remove this tooth and put the patient through an expensive implant bridge, which would probably be upwards around $3,000, could be more if a bone graft and specialists were involved. Could get, it's definitely a 4-figure restoration here. Probably not really necessary. I would leave that to later if we had a more serious fracture, which this isn't. But just for the sake of completion, we'll throw the extraction in there and include that in our list. So probably the best option is the crown. Number 2 is the full white filling. Number 3 is a small repair. And the last option would be the extraction. So hope that gives you a little idea, Mrs. 1202, about your options with your fracture here. As problems go, this isn't a huge problem. Definitely reparable, definitely not a scary type of proposition, and getting this tooth going again, definitely well within the reach of restorability. What about time frame? When should this all happen? Well, obviously, when you have a fracture, when you have exposed tooth structure, it's always best to get it covered up, get it protected as soon as possible. It's analogous to driving around the street with no paint on your car and just bare metal. It's going to rust out pretty quick. Same with an exposed tooth. You can get away with it for a little while if there's no symptoms, but the last thing you want to invite is further decay or further fracture. I would definitely recommend getting something done on this, within sort of a couple of weeks time frame. Get something done. If you can't afford anything sort of more advanced, at least get a small repair, and that could probably buy you some months before you move on. So maybe consider those options. Hope that really helps. For those who are just watching, welcome to HelpMeWithMyTeeth.com. We welcome you to come over and visit us and start your own dental consultation based on your own imagery. That's what we're here to do. We're here to guide you in your own dental decisions, to try to save you money, to try to give you great advice, try to help you if you're in an isolated situation, you really can't get any English-speaking advice, and to help you have the best future of your dental health and make the most informed decisions. So we'll see you next time. Come on over and see us at HelpMeWithMyTeeth.com. Have a great day.